Hello, everyone. My name is Shuaib, and I'm here to talk to you about shoulder injuries and shoulder surgeries and all that good stuff. So I initially dislocated my shoulder about 3.5 years ago, and this was from doing wrestling and jiu-jitsu. Hopefully, you guys are a fan too. I'm a big mixed martial arts fan. So when I initially dislocated it, I saw a doctor. He did not recommend surgery. He said usually you would let it go for the first time. And since then, I've dislocated it multiple times. And I had to put it back myself um, after the initial time, which required me to go to the fucking OR and have the doctor put it in place. One of the most painful experiences of my life. And usually I can handle pain, but that was painful. And for those who have went through it, they also know what I'm talking about. So now, after 3.5 years, I have finally decided to go and proceed with the surgery, and I have the surgery scheduled tomorrow. Yes, tomorrow. I am very, very anxious, but at the same time, I'm excited because I want to get back to some of the activities that I have wanted to do, like for instance, throw a football, get back in the ring, and get on the ground and do jujitsu or wrestle. So I'm excited, but at the same time, as of today, I'm very anxious, and I'm making this video so I can relate to those people who are going through the same thing I'm going through, and hopefully my experience and my information helps you. So I'm going to give you guys some hints and tips on how to prepare for the surgery and what you need to do before the surgery. Now, I'm going to talk about my injury, specifically of what happened to my shoulder and what they're going to do to repair it. So these are my MRI results. I've done CAT scan and MRI. These are the MRI, and the findings are indicated here. I have a large superior tear that goes anteriorly to posteriorly. So it's a big labral tear. And I've also developed Hill-Sachs deformities or Hill-Sachs lesions in my glenohumeral joint. And for those who are not familiar with the anatomy, so this is your socket of your shoulder, and this is the ball of the socket that sits in the shoulder. So the more you dislocate your shoulder, the more of that deformity you can cause and damage you can cause to the bone. And I believe that's what's called the Hill-Sachs lesions that have resulted due to the dislocations. As far as my rotator cuff, there is no injuries to that. There is no injuries to my acroclavicular joint. And yes, so it also shows, if you want me to be more specific, it's called a slap tear, SLAP tear, and I also have developed that as well. And it's unfortunate because I could have fixed all these and prevented all these from happening if I had gone with the surgery initially. But my doctor did not recommend that after my first dislocation. I thought it's something that, hey, they don't recommend, so I'm not going to go pursue it. So I went on doing, my activities and dislocated it, put it back in the place myself, and now I have to go through numerous things that I have to fix. Um, so I have a list here that I'm going through because this is my first video and it's kind of nerve-wracking. I was not anticipating, but right now I'm kind of struggling, to be honest with you. I don't know why. Like, I'm in a room by myself. Maybe my cat is here too. He's actually sleeping. He's passed out. He said, "You're boring." It's a Persian cat. It's not what we're discussing right now. So let's get back. So tomorrow's my surgery, and these are some of the things that I have to do to prepare for my surgery. They want you to have no drinks or anything to eat. I take that back. So you can drink, but you can't eat past midnight, past 12 o'clock. No candy, no mints, no chewing gum after 12. The day of your surgery, you cannot smoke. If you're a smoker, you cannot do it. And if you do have any medications that you take regularly, you can take it. They allow you to take it with a sip of water, and you can brush your teeth. What else? What to wear and what to bring to the surgery. So it says, please bring your x-rays, MRIs, CAT scan, any films that you have had of your shoulder. And they want you to wear loose clothing, comfortable clothes, preferably button-down shirts, because it's easy to put your arms around it and put it on. And they do want you to take a shower with antibacterial soap. Do not bring money or valuables. Do not bring or wear jewelry. So this has to come off tomorrow. Wedding bands. I'm not married, so I'm not worried about that. No makeup, cologne, perfume, or lotions. Dentures. They must be removed. I don't have it. So if you have any medications that you're taking regularly, please have them written in a list and take it to them. And yeah, so you want to take your insurance card, your photo ID, and any of those films or x-rays that you have had of your shoulder. Now, I'm going to be posting videos after my surgery as well. I'm going to keep you guys updated of what I'm going through, what kind of pain I'm going through, and hopefully you guys can learn and take something from this. And as far as my shoulder right now, I have no pain. I have very good range of motion. Hopefully I can maintain that. Obviously I cannot maintain that right after the surgery, but after I go through physical therapy and I'm looking in like 6 months or so, I can do things that I'm able to do now without dislocating it, obviously. But I'm going to show you guys my range of motion right now, and what I can do and what I feel like, and when I feel like it's getting unstable, so I kind of avoid doing it. So I can lift my arm easy, and it's the same thing with my left. So my right shoulder is a problem. I can extend it laterally, up, down. My strength is really good. I can do this, and it's almost the same as the other one. It's a little bit stiff, and there's like a slight dull aching pain like when I do this, when I extend it. But otherwise, it can do pretty much what this hand can do. It can also do this behind the back, and it can go far. This, and it's the same the the other hand, it's fairly the same. I'm surprised, I've dislocated my right, as I said, like numerous times, about 10 to 13 times, and I lost count afterwards. But I know it's between that range. And every time I did dislocate it, I was putting it back myself, and it's just getting annoying because at the end, well, by now, slight things would trigger and would dislocate it. For instance, just going under the water and swimming um, would get it out. If I shot a basketball in the wrong way, get it out. Obviously, I was nowhere close to um, getting back on the floor and wrestling or do any jujitsu movements. Let's see if I missed anything else. So, as far as the repair and what my surgeon recommended was just a labral repair. They also suggested remplissage or ladder J. These are French terms and French procedures that are done when the shoulder is really unstable or if there is any severe deformity to the bone, in which I do have, but mine is not as severe, so I do not think they will require those procedures. Those procedures are remplissage or ladder J, by the way, if you want to look them up. But my surgeon said that that's something that they're gonna look during the procedure, whether those surgeries or additional procedures required for my shoulder, and hopefully they're not, because I don't want anything else additional added to my shoulder. This is my first surgery, and hopefully this is my last. I'm a bit nervous. Well, I am nervous, but I'm a medical student myself, and I know that I have to do this in order to get back to things that I like. So I hope this helped, and please stay in touch, or please let me update you after my surgery. Wish me luck and have a great day. Thank you.